Hi guys, I'm back. Okay, I'm wearing glasses today. Oh, how exciting. Actually, no, my contacts for some reason were getting blurry all the time and I don't know, I had to take them off. So I had clinical on Monday again. It was my second clinical for mental health, and this time we got assigned a unit, but not a patient, and then the nurse pretty much assigned a patient for us. I was actually put in the women's trauma unit, and it was quite interesting. I would say women are very needy, but it was quite sad. At first they were very, I just sat and observed, kind of like them walking around and kind of researching my patient. Can't tell you much about my patient because of HIPAA or anything like that, but it was quite interesting. Most of these women, of course, it's women's trauma. It's like rape, abuse, mental abuse, or stuff like that that they've been going through their whole lives, or they recently just started. So it's very tough. And at times, actually, before I get to that, while I was observing them, most of their things was not about how they felt. It wasn't talking about feelings. It was mostly about, oh, I have this pain, I need this medication. I have this pain here, I need this medication. I need this medication now. I need this now. I need that now. I need this now. That's what I kept observing. I finally got to sit into a group discussion, or like a group counseling kind of thing. And the one I had, I forgot what it was. I can't remember the name, but I'll probably like post it somewhere up here to tell you what kind of group discussion or group therapy it was that they had. But basically, this counselor came in, she gave her background. She was a recovering addict. I believe she said she was also abused, and I forgot other stuff, and then how she ended up being a counselor. It was very motivational to hear her. And then it was interesting how she would turn around things, because one common trend I saw was that these women would talk about other people's problems besides their own. Or when they did talk about their own, it was like this self-worthlessness, I guess, where they didn't feel loved, or they just didn't see themselves as good enough, or stuff like that. It was really tough to hear, because I mean, sometimes when you're in a relationship or about to go in a breakup or anything like that, you tend to think like that. So it was rough to hear some of those things while I was sitting there, because it kind of brought back my past relationships, and I was just like, oh, I used to think like that. I was like, I didn't have good self-worth, I guess. And things that you don't realize that still, you think you've moved on, but it still sticks onto you until someone brings it up. So I will say, being in that little group was a little tough. And trying to keep like a straight face during that whole time, just hearing their stories also, which was heartbreaking, was hard. That was probably the hardest thing I've done. I didn't think it was gonna affect me as much as it did, but overall I was able to keep my composure, keep a straight face. I mean, I'm pretty good at lying about my emotions. But yeah, it was a tough one. It was a very tough clinical that I had to do, because one, it was relatable, some of the things that they said, and two, their stories were rough. It was really rough to hear, I mean, and it kind of just taught me a lot, but overall it was a good experience. I liked it. It kind of showed me perspective and things, and it was just it was good overall. Next clinical was MedSearch, which was a Condell, of course, duh, my favorite place. It was fun. It was actually pretty funny because I got a nurse who was like, I should not be teaching students. Everything I do is not what you should do. But like, she was by far so smart. She knew what she was doing. I was just like, maybe there was a couple of things that she did different, not by the book, but it still worked for her. She still abided by the rules, but it just, there's certain things she did her own way, and it worked for her. Has she messed up? I don't know. Will she probably mess up later? Who knows? Even people who go by the rules mess up. So that was just my mindset. But she was really good. She knew what she did. I love that she would talk me through when she gave a medication, why she was giving it, and what would happen, what I should watch out for. That was really nice. She knew her stuff, and it was great. What else? Otherwise, I still didn't get to do a full head-to-toe assessment, but I got to do a quick little neuro check because our patient was talking about how he felt like he was losing strength in his right hand. So we kind of did a full neuro check on that and notified the doctor. Not sure what happened after because I ended up having to leave. But if I get a chance, I probably will ask for next week if we know what happened with the patient. I mean, the neuro checked off. It was only his grip strength that was a little off, but otherwise it was fine. This week I have a quiz and an exam. So the month of February is exams month. So I have an exam like every week. It's okay though. It is what it is. It is school and it's accelerated. I'll be done in December. Guys, hopefully I'll be a nurse in December. How exciting is that? But yeah, you guys have a wonderful day. Please comment, subscribe, leave me any notes of anything that you might want to hear or want me to change around with my videos. But otherwise, I don't know if you guys are okay with just me talking to you and how my day is going. I don't want to record me going in the hospital because I don't know if that's like breaking the rules or anything like that. But maybe at some point when I'm more comfortable I will. But for now, you just get my pretty face. Just kidding. And talking to you, and that's about it. So yeah, comment, subscribe, turn on the little bell notification to know when my next video is. You guys have a wonderful day. Okay, bye!